Hi everyone, I'm Rebecca Brown. I'm a geriatrician, which means I'm a physician who specializes in the care of older adults, and I'm a researcher and associate professor of medicine in the Division of Geriatric Medicine here at University of Pennsylvania. And I'm going to be talking to you about functional status among older adults and what that is. I'm going to discuss three main topics today. The first is, what is functional status and why is it important? The second is, how does functional impairment develop? And the third is, how can we improve functional status among older adults? So before we launch in, I'd like to take a moment to define functional status. So functional status refers to the ability to do daily activities that are necessary to live independently. The first type of daily activity is basic activities of daily living. This includes bathing, dressing, getting in and out of a bed or chair, toileting oneself, walking across a room, and eating. And the second is more cognitively complex instrumental activities of daily living. These include things like managing medications, managing finances, preparing a meal for oneself. So these activities can be measured both by self-report, so if a patient tells you about their ability to do these activities, or by observation. If a trained health professional, like an occupational therapist, observes an older adult's ability to do these activities and then rates it. And both of these approaches are considered validated ways to measure functional status. And also importantly, loss of functional status is considered part of the diagnosis of dementia, which is decline in cognitive function accompanied by difficulty performing daily activities. The last thing I want to mention is that functional status is also distinct from physical function, which refers to the ability to grip, to do a functional reach, and other activities that are components of these larger basic activities of daily living and instrumental activities of daily living. So now we're going to discuss why is functional status important. So the first reason is that developing difficulty or needing help with these daily activities is extremely common among older adults. 25% of older adults ages 65 and older have difficulty performing one or more of those basic activities, such as bathing, dressing, transferring, and 10% need help with one or more of those daily activities. And secondly, functional status plays a very important role as a predictor of adverse outcomes among older adults, as well as an important outcome in itself. So as a predictor, having difficulty or needing help with those basic activities of daily living is associated with increased risk of acute care utilization, so going to the emergency department, going to the hospital, increased risk for being admitted to the nursing home, increased risk of mortality, needing more caregiving services, and also higher costs. But secondly, and also very importantly, functional status is an important outcome in itself, meaning that if you ask an older adult, what's most important to you as you get older, one of the things that you'll often hear is that they want to remain independent as they get older and able to do activities on their own. And part of the reason for that is likely because our sense of ourselves is so tightly tied to what we can do in the United States. So as we begin to have more difficulty with those daily activities, our sense of ourselves shifts too. So now we'll turn to the second topic of how does functional impairment develop? And to talk about that, I want to share a conceptual model that's been helpful to me in understanding that, which was developed by Verbrugge and Jeté in the 1990s. And what they propose is that there's a pathway through which people progress as they develop functional impairment. It starts with pathology, proceeds to impairment in organ systems, then to functional limitations, and then to disability. So to give you an example of what I mean by that, I want you to imagine that someone develops pathology. In this case, let's think of diabetes. So an older adult develops diabetes, meaning elevated blood sugar. And over time, that elevation in blood sugar is going to affect the nerves in that person's hands and feet, so that they will start having neuropathy or numbness, tingling in those parts of their body. And over time, that's going to make it more difficult to do some different tasks, such as balancing and walking. That will lead to functional limitations, and over time, if that progresses further, to difficulty performing some of those basic activities that we discussed before. Verbrugge and Jeté conceptualized three different types of factors that influence how quickly individuals move along that main pathway from pathology to impairment to limitations and disability. And these include risk factors that act in the earlier part of an individual's life and influence their risk of developing pathology. So what are some common risk factors for functional impairment? They include having older age, being a woman, identifying as Black versus white or Latino, having lower socioeconomic status, meaning having lower income, net worth, or educational attainment, having chronic conditions such as diabetes, having cognitive impairment, sensory impairment, and so on. Second, Verbrugge and Jeté talked about what they call individual factors that come into play after an individual develops impairment. These encompass how an individual reacts to having those impairments. Do they seek medical care? Do they change their exercise routine, for example, for a person who develops diabetes? And what are their coping strategies and skills? And finally, Verbrugge discusses the importance of external factors. These include things like access to medical care, access to rehabilitative services like occupational therapy, physical therapy, speech-language therapy, and so on, access to supports in one's community, one's family, or paid caregivers, and also features in the environment to help an older adult adapt to impairment, such as grab bars, a shower chair, a non-slip rug, and so on. And finally, we'll discuss how we can improve functional status. We'll take kind of a 30,000-foot view of this, discussing both upstream interventions as well as downstream interventions to improve function. So what I mean by upstream interventions are interventions to address risk factors that can then prevent or delay the onset of functional impairment by addressing some of those risk factors that occur earlier in the life course that we discussed before. An example of an intervention that could address some of those risk factors might be a physical activity intervention. These interventions can occur either at a population level or at an individual level. For example, at a population level, you could imagine an intervention to make a community easier to walk in for older adults. Whereas at an individual level, you could imagine a tailored exercise program developed for one particular patient. And second, you can imagine a downstream intervention that's focused more on providing services and supports to help individuals adapt to and cope with functional impairment. An example of a downstream intervention might be having an occupational therapist come to an older adult's home to do a home safety evaluation, and then to make recommendations to adapt the environment to help an older adult function more independently in their home. For example, installing grab bars, bringing a shower chair, and so forth. And of course, you can also have interventions that combine both upstream and downstream components to help older adults live and function more independently. Thank you so much, and if you'd like to learn more about this topic, please visit the Penn AI Tech website.